So I was asked by a prednisone warrior, "Hi, do I stop taking the rest of my prescribed vitamins when starting with Nutranize? Or do I add Nutranize on top of the rest of my daily prescriptions? Also, is this okay for CKD patient stage 4 IgAN? Thank you for your time." Okay, so let's answer the first question is how do I stop taking the rest of my prescribed vitamins when starting with Nutranize? So this is Nutranize, the first and only supplement for people on prednisone, and I invented it. I designed it so that it could be your one and only thing that you need while on prednisone. It's like a one-stop shop for all of the nutrients that prednisone is depleting. So basically, if it's a prednisone concern, this has got you covered. So whether it's your bones or your risk for heart issues or your risk for blood sugar changes, mood changes, sleep issues, this is here for you. This is here to support you. If you have other concerns, then this isn't going to be all you need. So basically, most of the ingredients is 100% of the daily value when you account for both doses, 2 in the morning and 2 at bedtime. And so for most things, this is enough. Some exceptions that are notable include if you're taking methotrexate for your autoimmune condition, you may need to be taking more folate. So there is excellently available folate in here. It's the L7 methyl tetrahydrofolate. And so you don't need any more folate for most people, but for some people on high doses of methotrexate, they'll need even more, and it's a prescribed version. So that would be one you would continue. It's for some people, they might need a higher dose of calcium than is available in here. And those would be people who have a family history of osteoporosis, like a close family member who've already had a fracture, who've already broken a bone, lost height in their spine, who are taking other medications that worsen osteoporosis. So for somebody who has osteoporosis, you might need higher dose of calcium. For most people, this is enough. This is supportive along with a healthy diet. So how do you stop taking the rest of your prescribed vitamins? So prescribed vitamins is a term I just want to focus on though, because if it's prescribed by a doctor, then you'd want to talk that through with a doctor. But if it's something that you chose to add yourself, then you can talk to your pharmacist and they should be able to help you figure that out. You can schedule an appointment with me. We can go through and I can help you de-prescribe. I have a resource of de-prescribing pharmacists out there. But basically, we can go through and see, is it listed on the supplement facts? If it is, you don't need to keep taking it. If it isn't, then that's something you can consider. If you're taking something for like joint pain, like for example, you're taking ashwagandha or you're taking turmeric or something, then those are not included in this, but you can continue taking those. They should be fine. But if you want me to go through it with you, that's something I'm willing to do. You just have to schedule an appointment at my Calendly and we can go through that in depth. I also have some other friends that can help you with. So that was the first thing. And basically, I guess, how do you do it? How do you stop taking it? You would just literally replace it with this. You can just throw away all of the other stuff that is duplicating Nutranize. You wouldn't need them anymore. And you're going to need a smaller medicine cabinet. And yes, you add Nutranize on top of your daily prescription. So your prescription medications, you should continue taking. You should not stop something a doctor prescribed for you. If you're getting it from a pharmacy, you should be continuing that unless you're noticing that somehow your blood pressure or your blood sugar or something is getting lower because of what you're doing with Nutranize. But generally, you need to be working with a doctor to continue your prescriptions. So next, is this okay for CKD patients stage 4? So I tried to design Nutranize to be safe for people who had kidney and liver problems. I can't guarantee that. Stage 4 is pretty far advanced, and I would definitely talk to your kidney team. And then the nephropathy, yeah, like it's generally safe, but I really can't guarantee that. So talk to your team about it. The people I can say I would not take this in would be people who have kidney transplants, because if they're taking tacrolimus as one of their immunosuppressant transplant drugs, because this does have a drug interaction with tacrolimus, and we do not want people losing their kidney transplants. It's not worth it. So take the tacrolimus and don't take this if you're taking tacrolimus. So that should answer your question. Thanks for reaching out, our prednisone warrior for today. Thank you. Signing off as Dr. Megan, your prednisone pharmacist, inventor of Nutranize Zone.